Let's talk about jaw surgery. For a lot of people, it feels like this huge, high-stakes gamble. You desperately want to get back to normal, but the risks, they can seem really scary. So, is it worth it? Is the risk worth the reward? In this explainer, we're going to dig into the data and really unpack the choice that patients are facing.
Okay, so picture this. There's been an accident, maybe a fall, and now you're dealing with a mandibular condylar fracture. So that's a break in the part of your jaw that connects to your skull, right up by your ear. It's a really complex and super important joint, and the first question that pops into your head is, how on earth do we fix this?
Well, you're basically looking at two main paths. On one hand, you've got conservative treatment. That means no surgery. And yeah, that helps you avoid scars and the risk of infection. But, and this is a big but, the source material is pretty clear that if the bone is badly out of place, this approach often just doesn't work. You don't get your full function back. The other path, of course, is surgery. The goal there is to perfectly realign the bone, which leads to much better results for your bite and jaw movement. But it comes with what the study calls a biological price. In other words, surgical risks.
So, what is this surgery we're talking about? It's called open, rigid internal fixation, or ORIF for short. It's an incredibly precise procedure. The surgeon literally goes in, puts the broken pieces of bone back exactly where they belong, and then uses some internal hardware. Think tiny plates and screws to hold everything right there while it heals.
Now, this isn't just some random grab bag of parts from a hardware store. What's amazing here is how specialized this stuff is. They use different materials like titanium or even magnesium that can dissolve over time. And the plates come in specific shapes, like an A shape or an X shape. It's not one size fits all. They are picked to perfectly match the curve of your jaw and the exact type of break you have. It's all about making sure that bone heals perfectly.
Let's be real though. For most people thinking about this, the fear isn't about the little screws and plates inside their jaw. It's about the facial nerve. That nerve runs right through the area where the surgeon needs to work. And the thought of your face not moving the same way again, that is the single biggest worry that makes this decision so tough.
And then you see a number like this one. And that fear feels, it feels completely justified. 50.45%. Let that just sink in for a moment. It looks shockingly high. But what does it actually mean?
There it is. That's the full sentence. Just over half of the patients in this really big study had some kind of facial nerve weakness, from very slight to more noticeable, right after their surgery. It is a common complication, but the key phrase here is right after surgery. This is not where the story ends, not even close.
So let's break down that scary 50% number. This chart, this tells the real story. See that blue section? Almost half of all patients had no nerve issues at all. 0. Now, for the half that did, look at that huge purple slice. Nearly 49% of all patients experienced transient, that means temporary, weakness. The risk of it being permanent, that tiny little green sliver, was less than 2%. That context changes everything, doesn't it? So this brings us to a really important question. What actually influences that risk? Because it's not just random chance. The research shows that there are specific things that can raise or lower your chances of complications. And you know what? Knowing what they are is incredibly empowering. Okay, one of the biggest factors. It's the surgeon's technique. Look at this chart. It's comparing the risk of temporary weakness between two different surgical approaches. The difference is it's dramatic. The preauricular approach has a 69% chance of temporary issues. Compare that to the retromandibular approach at just 13%. The study found this one to be way safer for the facial nerve. It just goes to show that how the surgery is done matters a lot. The complexity of your actual injury also plays a big part. This data shows the average weakness score 3 months after surgery, and a higher score means more weakness. You can see that patients with just a single fracture have a lower score than people who had bilateral fractures, meaning breaks on both sides of the jaw. And that just makes sense, right? A more serious injury often means a more complex surgery and naturally a longer road to recovery.
The study also pointed to a few other things that can affect recovery. Basically, more complicated situations, like injuries from bad falls, fractures that are really high up on the jawbone, being an older patient, or just being in surgery for a longer time, all of these were linked to more weakness right after the operation. But here's the key thing to realize. These factors mainly affect the initial recovery, not necessarily the final long-term outcome.
All right, so we've laid out the risks, we understand what can influence them, but that brings us to maybe the most important part of this whole thing. What happens if you do end up with that temporary weakness? Do you just wait and hope for the best? Research says absolutely not. This quote from the authors of the study really just says it all. They conclude that not only is the weakness almost always temporary, but it can also be effectively treated. There is a clear, proactive plan to get you better. And here is that plan. It's a proactive 4-step protocol. It kicks off right away with medicine to get the swelling down. That's followed by things like vitamin B supplements and kinesiotaping, which is this special kind of tape that helps support the muscles. Then you start targeted physical therapy, which might include things like magnetherapy to speed up healing. And finally, you do active facial exercises to help that nerve wake up and start firing correctly again.
So, the big question, how well does this protocol actually work? This timeline gives us the answer in plain numbers. After just 1 month, 38% of patients are fully recovered. By 4 months, that shoots up to 76%. Get to the 6-month mark, and an incredible 94% of patients have their full facial function back. And by 2 years, it's 98%. The data couldn't be clearer. Recovery isn't just possible, it is the overwhelmingly likely outcome.
So, let's just bring this all home. What's the final verdict here? First, when a bone is displaced, surgery flat out gives you a better result. Second, yeah, temporary weakness is pretty common, but the risk of that being permanent is tiny, less than 2%. And finally, and maybe most importantly, for the people who do have those temporary problems, there's a clear, proven, and highly effective plan to get them back to 100%.
Which brings us right back to where we started. With all this information, understanding the real odds, and seeing that there's a clear roadmap to recovery, that initial decision starts to feel pretty different, doesn't it? Maybe less like a blind gamble and a lot more like a calculated, informed step toward getting your health and your life back on track.